Hello, everyone, and welcome to today's webinar on developing smart homes. My name is Ash McCaskill. I am the programs coordinator at AgeWell. So just before we begin with this exciting webinar, I just want to give some access points. So please note that today's webinar is being recorded and will be available on the AgeWell YouTube channel after the event. You can also note that there is closed captioning available, which you'll see at the bottom of the Zoom window, and you'll have two CCs. Just note that that it's an automated text, and sometimes there'll be an inaccuracy from time to time. But when you do choose it, it will show up as like a white text with a black background. And also just to ensure that everyone has a good experience today, we do expect all speakers and attendees to show respect and kindness while sharing the space. So any form of harassment that is shown, those people will be removed from the event. After the event, after today's presentations, there'll be a Q&A. You can use the Q&A box or share in the chat any of your questions, or if you feel like it, raise your hand and you can come on the mic. We do encourage you all to share, to use the chat today. Any thoughts, comments, or resources that can engage with other attendees, please do share. And so with that, we invite you to share where you're coming from today. So today I'm coming from Montreal, Quebec. And finally, I'm going to introduce today's amazing speakers. So I'd first like to introduce Dr. Shehroz Khan. Shehroz is a scientist at the Kite University Health Network, Canada. He's also cross-appointed as an assistant professor at the Institute of Biomedical Engineering at the University of Toronto in Canada. Dr. Khan's main research focus is the development of machine learning and deep learning algorithms within the realms of aging, rehabilitation, and intelligent assisted living. As principal investigator and co-PI, his research program has been funded through several Canadian, US, and other international industrial grants. He has funded 78 academic papers in top international journals and conferences that have garnered more than 3,850 citations on Google Scholar. And yes, that's 3,850. That's a lot. So kudos to Shehroz. That's amazing work. It just goes to show how important this type of work is. And I'd also like to introduce Dr. Bruce Wallace. Dr. Wallace is the executive director of the AgeWell SAM3 National Innovation Hub, adjunct professor at Carleton University, and affiliated investigator at the Bruyère Research Institute. He has worked 24 years in the technology sector at BNR, Avaya, and Nordtel Networks. Dr. Wallace is focused on industry collaboration to create technology solutions to enable the independence of aging adults. This includes fundamental research on novel sensor designs through to algorithms using machine learning and AI techniques. The work of SAM3 is founded on multidisciplinary research that brings together diverse skills of technology, medicine, social sciences, aging adults, and their care team to build solutions that are truly focused on the needs of society and especially the aging population. So before we begin, I just want to share that we will be doing two presentations. Dr. Khan will be going first, and then Dr. Wallace will be going after that. And then we will have our Q&A. So thank you again to both our esteemed speakers, and I will pass the mic to Shehroz. Thank you so much.
Okay, so I hope you see the presentation. Just 1 second. Just trying to start the slideshow here. Okay. So you can see that, right? Okay, good. So good afternoon. It's right noon here. So great to see everybody here. And so happy to be here at this talk. So today I'm going to talk about a very interesting work that we did and some of the findings around the user perceptions of smart home devices. Now, I believe that many of us already use some types of smart home technology. So I would encourage you to write in the chat box if you have used or if you're using any smart home device. I mean, that could be as simple as a smart TV or some types of sensors that you're using or some specific specialized devices, voice, like Amazon Alexa or things like that. So if you have used anything like that, please write in the chat box. So smart home technologies are getting, popular. You can literally go to Best Buy and get many of these smart home devices, even, whether there's a cat in your backyard or not, those as simple as that, right? Motion sensors and things like that. Now, definitely it provides a lot of benefits, concerning our security, convenience, even some of these devices can be used for improving our health situations. There are lots of automated sensors that can be used for recording your blood pressure, your heart rate, and other types of things, right? But then smart home technologies or these devices also present several ethical, privacy, and security concerns that a lot of the people may not be aware of that. So with this context in mind, uh, we started to look into the literature. And previously, what we observed was most of the studies were focused on the acceptance and adoption of these devices. So, are people willing to use these devices? But we wanted to take the next step, and we wanted to uh, look this more from a surveillance perspective. And these are the 4 points that we came up with: privacy, purpose, risk, and safety. So these are the 4 dimensions we came up with, and we said, okay, let's figure out what are the people perception on that. So privacy, for example, what does privacy even mean to you, right? How these devices are storing their data, how they're using their data. Purpose, again, what are these devices, for what purpose they are collecting the data, how your data is collected, how it is being used. Is it used for advertisement, or are they selling your data to other third party? Risks, what are the risks of using these devices? Can they cause health issues or things like that, right? And then safety, how does using smart home devices change your perception of safety at home? So these were the 4 dimensions, and then we did this literature review, and we reviewed English papers, and these are some of the details. I'm going to skip a lot of these details because I initially prepared this more from an academic perspective, but I think for this audience that we have today, we don't have to go into too much details. But for interested audience, we use something called a scoping review. So in a scoping review, we follow a particular methodology. So we create search query, we give it to the librarian, they send it to us a list of papers, and then research assistants and team members manually, select these papers. If there is a conflict, then a person like me will jump in and resolve those conflicts. And so it goes through 2-3 steps, and at the end we get a final list of papers. So these are some of the keywords that we use. Not really. I'm going to skip this. So in the end, these are, I think overall we got like around 59 kind of studies, and then we found that many of these papers looked into privacy, and then purpose, risk, and safety. So these are the number of papers that we found. Now let's dive into what our findings around privacy of using these smart homes. So what we found from the literature that we gathered was that younger people were more concerned about the privacy, but at the same time, older people like 65 years and old are also concerned about the privacy, So these types of findings sometimes break a little, certain stereotypes. You may think, oh, at certain age, people do not care about privacy. No, that's not true. So younger people and older people are equally concerned about their privacy. Now, in terms of geographical information, it's very interesting that American users, based on our survey, literature review, American users were less concerned than the Dutch, and then the French and UK users were less concerned than the, like some Eastern European countries like Poland and Romania. So there are some geopolitical factors also that plays their role in terms of privacy. In certain countries like China and others, surveillance is done at a very large, mass scale. So people sometimes do not have any choice if you have a different type of system. But in mostly in democracies, even in democratic world, there's a lot of surveillance going on. But then still, democracy, people have their opinions and they can share their thoughts more openly, I believe. So, but then again, we see different contexts uh, around the perception of privacy around at different geographical locations. We also found that so primary users are the one who are using these devices for themselves, or secondary users are those who are using for their loved ones or caregivers. So primary and secondary users both were concerned. And it's very interesting that women were more likely to believe that the main purpose of these devices is to control family members. So now we're seeing gender role also playing into this equation. And uh, and other couples were unconcerned, but yet possibly uninformed. So there is a lot of discussion around whether people are even are well informed about their data being collected or not. Okay. And then the state of surveillance emerged as a matter of concern in countries like US and UK. Like, as I said, my personal experience, I think UK is heavily surveillance, all the streets everywhere. They have these cameras and all that for security purposes. But then people are also concerned about the involvement of state in terms of their personal data surveillance, right? And then there's a lack of trust in corporate entities. Um, People do not trust. Most of the people do not kind of trust how their data is being collected and what is being used. But then an important thing, and I'll talk about this a little bit later, is that nothing can be done about this. People are aware that a lot of data is being collected. We don't know what it is going to be used for, but there's nothing I can do about it. And I'll touch upon this, what it means. Yeah, so, and there is very limited privacy preserving behaviors enacted from those people who were even concerned. So people are literally giving up uh, on this. Okay, coming back to purpose, there was a lot of confusion over the data collection practices, like what is collected, what is the purpose, is it going to any third party and stuff like that. And then another theme emerged was around privacy paradox. Now, this is a very interesting concept, and if you have interest in psychology, so privacy paradox tells us that I am aware of privacy, but I'm not very careful about it. So, for example, I'm a very private person. This is my house, this is my family, this is my kids, and I'm a very reserved person. I keep everything private, but I'm gonna tell everybody on Facebook that I'm going to Bahamas on a cruise with my family or with my kids or things like that, right? So at one end, you're a very private person, but the second moment, you're literally telling everybody in the world about uh, your plans, your travels, and what you're doing, and are you doing barbecue, things like that. So this actually constitutes this privacy paradox. Like we are aware of it, but we are not very careful about it. And there was very high level understanding about some of the health related sensors that we found, and very general awareness, especially in people with technical background. Okay. In terms of risk, users were concerned about the the security of these devices and the potential of being hacked. I don't know. A few years ago, there was this very interesting, but at the same time not so pleasing story came out that in UK there are these baby cams. So parents who are working, they place these baby cams in their homes to monitor their children, and those cams were hacked. And apparently, some bad people got access to those cameras, and they were watching those kids without, of course, their consent and illegally. So these types of stories you will hear here and there, and that actually is a potential risk of your data, and you are going in public or in some criminal hands, without your knowledge or consent. So how secure are these sensors? How are they transferring your data? Is it safe? Is it encrypted? Those kind of concerns are quite predominant. And then again, risks also lead to trade-off. So there's always a trade-off between benefits and what are the benefits and the risks. And some of the themes that emerged are around affordability, convenience, autonomy, and safety. So people are willing to risk some of their privacy um, at the cost of, if it's affordable, if it's a cheap sensor, and if it just makes your life convenient, if it's like a doorbell to see who is at your door or something like that. It's convenient, I can see, I can monitor, but then at the same time, you may also risk losing some of the privacy elements there. Okay, and last point is around the safety. So users in general were enthusiastic about the safety enhancements that were brought with these smart home devices, and they were willing to trade privacy for safety. And older adults, especially, and healthcare recipients value these smart home devices, I think, more. And we see some cases in Philippines, US, South Korea, and countries like Bahrain, where old adults they went out and reached out to older people, and then their response was more positive. And as the time is progressing, I think people are becoming more comfortable with smart home devices. You may have this device in your house and you may not even notice it. It just becomes part of your home decor, or have, like, you do not notice your refrigerator or TV all the time. It's just there. So you can have a motion sensor, or you can have a bed sleep mat to monitor your sleeping cycle. It just goes under your mat, or any other wearable or other types of devices, but they are in your home, just part, it becomes part of your home rather than an external entity. So that is quite interesting to look at. So just to summarize the key results, what we found was that a lot of the smart home users were generally uninformed about the data collection practices, and they are engaged in this perceived trade-off between privacy, safety, security, cost, convenience. Like we discussed earlier, people are willing to trade off their privacy for other benefits. And coming to this uncertainty and this feeling powerlessness and mistrust. So there is a term for that in social science, what they call as privacy cynicism, or something more refined, what we call as digital resignation. Now, what digital resignation means, and this is a very important finding from this work, digital resignation means that you are so much exposed to all this digital media, all these devices, sensors. You may not even know that your TV is collecting your data. You may not even know that your phone and all these devices are collecting all sorts of data, right? And you know about it, but there's not much you can do about it. Like, you may want to stop some of those, let's say, location services, but most of these companies make these features very hard. So if you want to turn off your location services in Google or Apple, I mean, it's not very straightforward. Even for a technical person like me, you have to go into different layers of their system to turn it off, right? So they make it deliberately harder so that you just give up, and an average person can just give up and say, "Ah, I don't have time." So there's not much you can do about it. And you're literally resigning to all of this overwhelming sensors and technologies that you're using. And that is called digital resignation. So we also observe, based on this work, that there are unequal power imbalance between the social, sorry, the sensors, smart home devices users, corporations, marketers, insurance companies, state agencies, law enforcement, and other types of agencies. So we observe this power imbalance structures, and uh, we conclude that we recommend transparency and more accountability in terms of privacy legislations. And I think Canada is, we still do not have very clear guidelines around that topic. So I think one of the takeaway from this work is to influence, government and stakeholders to come up with certain regulations around that. Okay, and yeah, so future perception research in Canada is needed. So we have some work that is currently under review. I know in my slide, in my I think bio or whatever, we also talked about taking care of, like, running these studies, and we encountered some fake participants. But I'll touch upon that later on. So I'll stop for now, and I think Bruce can take over. Thank you.
Thank you so much, Shehroz. I'll invite Bruce, Dr. Wallace,
We
to
cannot
go.
hear you, Ash.
Oh, you
I
can't
can
hear
hear
me?
you. I can hear you, Ashley.
Oh,
Oh, yeah,
okay.
sure. Oh, yeah, sure, sure.
It's okay. Beauty of a live webinar and working virtually like this and remotely. So I'll invite Dr. Wallace to share his presentation, and thank you, Dr. Khan.
So thank you, Shehroz. That was a great introduction to what I didn't realize we were doing in parallel as complementary work. So, what you just presented is looking at age tech technologies and smart home technologies from the perspective of the end users and what they would want. We actually did a parallel piece of work, which was, let's go look at how age tech technologies are positioned in the marketplace so that can the end user actually make an informed decision? And so we're looking at it, and we were coming at this from our perspective of our team and the support of smart home, which I'll come back to. Get this to forward on the right monitor. There we go. So, quick acknowledgement. This is a body of work done by a number of people on our research team, and acknowledge my collaborators in the hub of Rafiq, Frank, Heidi, and Neil, and all of our students. So age, I'm going to start with a posit, which is, anything we're talking about doing as technology to support aging in place, we need to start with the older adult. They're the first and foremost person that we need to be considering in age tech, and then they are surrounded by a layer of individuals, caregiver, family, and friends, typically unpaid, who are supporting that person with their independence. And then you can move to formal caregivers, PSWs, and others who typically are paid or providing a service. And then you move into the more healthcare layers of it. Okay. And the cause tech we're looking at here is there's a role for technology, and we want to dive into it. So basically what we're looking at here is age tech, a set of products and or services intended to support aging in place and used within the home. So what's the supportive smart home? I'll come back to how we've posited this. I've extended, so Shehroz used the term smart home. I'm on the page now of calling them a supportive smart home. I do not need a sensor in my home or a system in my home that allows me by voice command to turn on a light. That's a real first world problem, solution to a first world problem. We're looking at how do we put technologies that actually support and enable independence for aging adults where it's really needed, something that helps them. So what are we looking at in here? Using sensors and systems and knowledge from stuff deployed in the home, the car, where needed, wearables, somehow taking that knowledge from the system and turning to data from the system and turning it into knowledge, and then ultimately leading to action, right? And this is where the support comes back. The action could be, now the turning on a light is interesting, but maybe it's turning on the light for them. You get out of bed in the middle of the night to go to the washroom and the lights come on for you, especially for a person living with dementia where it might be a visual cue of the washroom and a reminder. Okay, so the primary goal is supporting the independence of the older adult. So what were we trying to do? Our goal, we wanted to look at a bunch of age tech products on the market. We did this with public domain information from websites, etc. Nothing secret, nothing privately shared with us, right? And we wanted to look at the products from a different perspective. Is there an end user need that's actually identified? Who is the user they're expecting of the product? State of the product offer, and important things around understanding privacy, security, and other interaction. Our survey was based on a sample of convenience of what a student was able to do over the summer. Looking at in total, we ended up with 28 products that were on the market in the age tech space. They were a mixture of some medication trackers and home and appliance monitoring, bid and activity assessment. It was a myriad of products, and I will not name any company because we just did this off public domain data. Okay. And all of them were products that had a cognitive care characteristic in what they were talking about doing. So what was our analysis method? We looked at the products and we analyzed them against 6 different criteria. So one was life domain. So the quality of the dementia quality of life instrument by Broad et al. Has defined a set of different aspects of living, and we looked at what does the product address, any or all or a subset of these. Okay, we'll dig into them a bit more in detail as needed. Who's the intended end user? Is it the actual person, patient, or are we moving through the family and formal caregivers through to the healthcare facility? We'll come back to product interaction, but decisional autonomy and functional independence are important concepts I'll talk about when we talk about the data. What's the maturity of the product? What did they talk about in terms of privacy and security attributes and interoperability? So life domains. Okay, so if we look across the life domains, a lot of the products actually address more than one life domains. If you look at the bar chart on the right, you will see that the height of the candles adds up to a lot more than 28, because many of the products addressed more than one of the life domains, work and leisure being the life domain with the least number of products, only one that actually looked at addressing it. The table on the bottom left is now looking at sort of the crossover. So basically the way to read the table is if you take the row health and self-esteem, there were 19 products who claimed to do something in health and self-esteem. Of those, 42% also did physical space, 52% also did ADLs. So that's how to read across the table on what's going on. So you can just sort of get a feel for what products are doing different levels of different ADLs. Parts of living. This was a very eye-opening piece of data to pull out. So the question we looked at here was, who is the intended user of the product? And so the idea being the person, the patient, and you'll see in the candle on the right, they had, again, some products intentionally would have various intended users. So a variant of the person, the patient, with themselves could be an intended user of the product and interacting with it, and a different version for the caregiver, a different version for health services in the home, and finally the clinician use. None of the products, which I guess was good news, actually had a research mandate in what they were trying to do. They were all looking at actually serving the needs of the family. But the eye-opening thing is in the bottom left in the table, which is of the products who were positioned to provide services to the family members, supporting the care around this person, only 72% also had an intended end user of the actual patient person using the product. So, 3/4 of the time they're part of the puzzle, 1/4 of the time they've been left out. And then if you move down to the personal care support, again, 2/3 of the products actually also had a view for the person patient. 1/3 did not. And I think it's really interesting that products are on the marketplace where the person who's being measured or assessed is not actually considered a user of the technology. End user product interaction. So this gets at what's the goal of the product. So the idea here is it comes to two levels of how people can be using the technologies. Decisional autonomy is the older adult's ability to control decisions and direct those decisions. Functional independence is the older adult's ability to actually do it themselves. So the simplest example would be decisional autonomy. It would be the ability for a person to decide they want to get out of bed in the morning. And if the product allows them to do it themselves, that's also functional independence. Whereas decisional autonomy is it allows them to decide they want to get out of bed, but they now need to reach out to somebody else for help, and maybe it helps them do that. So you'll see that there's a lot of the technologies actually are doing both. There's only a couple of products who did only one, and a few products who actually did neither, which was interesting. Assessment of the product maturity, guess not surprising here, was we were working on public websites. So most of them were well out of the design and prototype stage and had some level of testing. And our criteria here was only one of them was not claiming any testing, what I'll say, outside of a lab research environment. 27 were actually reporting on real deployments with real people. So that's comforting. I didn't make a slide with the table, but the interoperability data is, again, a little bit eye-opening. Of the 28 products, only 9 referenced any definition of interoperability. And that is a big combination set of whether they claimed they had an API you could work with at some technical level. If they claimed IoT support, many cases they claimed IoT support without defining what it meant. So, again, we're not sure what it means underneath. We saw Zigbee come up a few times. There was a few products that had Nurse Call and Alexa integrations, but they were very thin, and what the interoperability was very unclear. It was very high level words, and the specifics weren't there, and very minimal references to standards. I think we had 1 or 2, for example, on IoT that talked about Matter as at least being a standard in this space. The rest of them just said, well, we support IoT. Data privacy and security. Let's build on the previous presentation. People want to understand it. So the next question is, can they educate themselves from the technology on the website? So this looked at it from a couple of lenses, right? Do they actually explain what data they're collecting? And of that, only 2 of them did it. The rest of them did not. And in the case of, is the data collected got any level of anonymization as one indication of privacy? Only 4 actually said anything about it. More scary is when we looked at security and encryption. Of the 28 products, only 9 of them made any statement about security or encryption of their technology and the data that they're collecting. And that number scares me because we gave a product a tick mark on this measure if they said the word security and encryption on their website. Most of them don't actually define what standards, methods, models they're using for that security encryption. So it's basically our data is encrypted, trust us, versus it's encrypted and is compliant with some level of regulatory or standards-based language. So my summary, I'm trying to work through quickly because I think we can have a lot of Q&A on this topic. Security and privacy, there is minimal reference to security and privacy on what's being done and how the products are there. Shehroz made comments about the confusion about that. In the US geography, there's HIPAA, which says something about privacy. In Canada, we have PIPEDA at the Fed level. And then when you move into the provinces and the territories, you get into a myriad of different regulations. But basically we didn't see them referenced. Data ownership and control, again, going back to Shehroz's presentation, very little description and discussion in the products about what the data is collected and who owns it and how it is going to get used, and who else might have access to it. Interoperability, the products are basically positioning themselves as a standalone, magical solution to a problem, and no real story for how they interop going forward. There's a lot of ethical considerations in the data ownership that need to get dug through, and they're confused. They're really important, and they need to be addressed. And currently, what's out there is unclear. So we need to move forward. So trying to sort of bring this to a summary. Older adults are the primary end users of the system. If they're the person that's interacting with the sensors, even if they're in a home behind the scenes and the person doesn't even remember they're there because they forgot about them, they're still the primary user, and their needs, privacy, security, need to be paramount. And it was depressing to see how many products did not take that into consideration. And the last piece, this is our model at SAM3, is the older adult needs to be included at the center of the aspects of all of the designs, from concepts through to being able to be educated about the final product. So this is Agewell. I have to do the advertisement, the exciting week. Myself and my colleagues, Frank and Neil and Heidi, we actually just wrote a book on the support of smart home, and it just hit press earlier this week. My copies arrived on Friday of last week. So there's a lot of information in there. People are interested in digging deeper, especially in the sections around this presentation and this seminar, the ones I pointed at in red, explicitly dig into that in some detail. So with that, I will wrap, and let's turn it over to questions.
Thank you so much, Bruce and Shehroz, for your great presentations, and also enlightening a lot of things I was learning just about thinking about privacy and how much is not shared, and how that adds to the unease amongst older adults around smart homes. So I do want to open it up to our attendees here. So feel free to share in the chat, or you can also raise your hand if you just want to raise your hand in the Zoom. You just go to I think it's just at the bottom. You'll see on the bottom window, there'll actually be something right beside where it says show captions. There'll be like a little hand like this, and it says raise hand. If you do that, I'll be able to see that, and you can actually come on mic and share your thoughts or comments. As we are waiting for those questions, maybe we could go back to that issue of privacy and security, which I know opens up so much. Bruce, you shared in your presentation and a little bit about how a lot of these websites didn't share a lot about those issues, and how in your review that there was only like a handful, not even that had any information. And I know, Shehroz, that was something that you touched on, was a major concern amongst older adults. What do you think is needed to move forward to help appease this issue so that there is more transparency around the privacy and security issues? Or do you think it can be done because maybe it's going to be an ongoing issue that a lot of these companies won't be able to implement in a meaningful way?
I can maybe start, and then Bruce can add on top to that. I think the model that a lot of these companies follow is around profitability, and that is fine if you only look at it from a product consumer point of view. Then okay, you want to sell your products more, you want to have, just go to Best Buy, and now you have section on these devices, so it's like you're buying apples and onions, from a store, literally, so you just but then I think as we are collecting more and more data about people, there needs to be more awareness. Like as Bruce said, as our finding, they're very similar, I don't see any any difference. Like in terms of companies are not transparent about their data collection strategies, their data storage strategies, encryption protocols that they're following. Now, there are several federal guidelines in US. We have HIPAA, and then in Canada, we have a slightly different variant. But then are they enforced? And part of the thing is, I think a lot of them companies get away because they just sell them as these products as your regular consumer devices like TV and fridge and stuff like that. But these devices are collecting more type of data, you know. So so I think that is a major point here. And I see a question also here. Are there any standards or, you know, around sharing? And I don't know, maybe Bruce can let us know about that more, but I think we are lagging a lot on this, and there is not much clarity about where the data is being stored. So just to give you the context, when we are doing any health related study in Canada, so it is mandatory by law that all the patient data, Canadian patients or people's data should stay within Canadian borders, right? Geographically speaking. Now, do we know if we are using this doorbell or this motion sensor in our home, is it storing the data within Canada, or is it going to US, or is it going to the Netherlands? We most of the time we don't know, we don't care. But I think we need to understand that these data can be used by law enforcement agencies. You know, so for example, in US, we have the Patriot Law, so they can use any data, anything that you're doing online. So we need to be aware of all those legalities and all those aspects. And I think companies are not very open about those. So yeah.
Yeah, just to follow up, it's a huge question, and the, you know, at one level, I think there are standards that exist that could be adopted, right? We don't need another data encryption standard. There's a lot of really good ones out there. There are standards out there for, you know, for other aspects of what's needed, you know, anonymization, etc. But I think there needs to be, whether it comes regulatory or from the industry, I think there needs to be, you know, we need to lift the bar. And I think the challenge that the industry is going to face is the convergence of, I'm going to call it the Wild West of consumer tech and the legalese of medical data. Because as soon as you cross that boundary and you get subject to, you know, the rules of medical data, it gets really confusing really quickly. And I think the companies are going to have an eye-opening event because you can blur that line very quickly now.
Thank you so much. I do want to just Farnaz did ask, and I know Shehroz and Bruce, you did touch on this. So what, like the gold standard? They meant the gold standard for how much data sharing is possible in this area. So I also want to kind of maybe build on that, and maybe talk a little bit about just like affordability. And because I say that because I know for a lot of older adults, sometimes the concern is the fact that this is something that that they can put in their house, or if they can even include, because it's so expensive often for a lot of them. And so there's been also a lot of talk in the field around like insurance, like, you know, so it's like, if we have those standards that are set one day, you know, what is the likelihood of saying, for example, like insurance companies covering some of the costs of some of these smart home devices? And what are your opinions on that, and where do you see it going?
I'll try that one first, and this firmly goes in the realm of speculation. So I'm going to go back to Farnaz's question about the gold standard for sharing. The first question you need to ask about sharing is sharing with who? Right? So the gold standard is anything about me should be shared with me. And then the next standard I would say is anything about me, I should control who else can see it. Right? And that'd be my simplest standard. And a lot of the products fall down miserably on that second sentence. And some of them fall down on the first one. But as far as the question going forward, I think it's a really interesting question. I think it's a really interesting question that it's going to come down. I'm going to think the insurers are going to come down to thinking about it at a business level. I'm sorry to say, but at the end of the day, it might be the right answer. I know I've had conversations recently with a couple of very large retirement groups. So you very quickly shift to who is the health benefits plan provider for them. And I think, if a technology is economic, that it makes sense for the insurer to put that in the portfolio of services they offer so that they can avoid the higher cost of the person going into care. It actually can not only be the best thing for the person, it can be the best thing from an economics model for the insurance company. And I'm hoping someday we will see it. And I think the good news is, Shehroz made the comment about wandering around Best Buy, is the good news is the actual dollar cost of the solutions has dropped so significantly because we can tap into the Wild West of the consumer market of, the Google Homes, the Alexas, etc.
Yeah, and just to add on to that, just two points. One thing that Bruce very rightly mentioned is around data ownership, right? So do you own your data? Do you really own your data, right? So you may think that, okay, all this data that is being collected by Fitbits or whatever watches and all these belongs to me. Yes, it belongs to you, but do you really control it? Do you have control on it? And I think companies deliberately, if I can say, I know this is going to go public, but I think they make it a little bit harder for you to control your own data. So I think one of the things that we came up with from our study is that we suggest that companies make these terms and conditions more simpler, right? Like who reads these terms and conditions? I think this is a very common question. Even I don't do that, because they throw huge amounts of text and you just sign it. And recently I had this conversation with my credit card company and there was an issue. And I said, oh, it does not make sense. But then he said, but you signed it. And I said, seriously? And he said, yes, it's on the contract. And this is clause 5A, C 3.2, and you signed it. And I said, I did not remember. I said, too. And he said, too bad, So we just sign it. We sign up for so many things without knowing it. And I think part of the reason is like, it's just too much information and digitally resigning, you just in the presence of so much information, you just say, okay, everything should be okay. So you are at fault if you don't know anything. I think that is a wrong notion. So I think that's one thing. Now, in terms of insurance companies, we know insurance companies are very clever, but there's a power dynamics issue also, and I mentioned in one of my slide. Uh, Sometimes what happens, and that came in our reviews, that I'm not just blaming insurance companies, it can be any actor, any stakeholder who has more power in terms of controlling your data and stuff like that. They can alter your behavior in many ways. And I can give you one particular example. Many years ago, for my car insurance, my insurance company sent me a device and they said, oh, this is a very nice device. You put it in your car and we will monitor your driving behaviors. And if you're a good driver, we're going to give you 10% discount. I was a student back then. I said, oh, yeah, sure. Why not? And I started using that and I figured that I would get alerts. They were issuing me too many alerts. They wanted me to drive in a particular way. I'm not a bad driver. I never had a ticket. I don't overspeed or things like that. But they had their own criteria, right? Oh, you're making a sharp turn. You're making this. Your acceleration was this. It was too much that after 4 or 5 months, I said, I'm going to remove this device. I don't need that discount because they are trying to alter my behavior, my driving behavior, which may be good from their perspective, but I'm following all the rules and I'm within the rules of driving, right? So that was a very simple example. But if somebody is inside your house and you have these sensors and everything, they might want to control how you live or how you act or how you behave in your house, which is totally your private domain, right? So I think we need to be a little bit careful around those power dynamics as well. So
Yeah, thank you so much. I wanted to go back to a point that Bruce brought up with how it's really important. Like the core of this is really looking at older adults and like prioritizing their needs because it begins with that. So I wanted to get your feedback on what you think. How do you think that these companies or anyone that wants to implement a kind of large scale smart home system in, like, say, like a long-term care home, how do you think they should be gathering the feedback from the older adults, and what like methods or systems should they be using? Because it seems like there hasn't been as much collaboration with older adults in the development and design of these innovations. Yeah, could you talk a little bit more about, like, what would you recommend to these companies or people that are looking to creating these systems? Like, how should they be looking at working with older adults?
I'll give you the start, which is what we do, right? I consider older, I have an advisory committee of older adults and caregivers that sort of at a governance level, I'll call it, in the innovation hub that we meet regularly. And from that and an extended community on many of our projects, we actually have one or more members of that committee who have actually said they want to be part of the research team. Okay, so they are part of the research team, right? So, they will get an authorship when we publish, et cetera, et cetera. Okay. And they're involved, do we involve them in the bits and bytes of every detailed research meeting? No, they're busy people. We want to have their lives, but are they there for every material decision around project direction and where it's relevant? Absolutely. Right. And I think that's what industry needs to think about, right? There's a large brain trust of retired Canadians out there who would gladly engage with companies on things that they're working on because it's fun to do, right? In and of itself, right? It's good for the older adult because they can get out and engage, use their brain, have some fun, learn some new things. There's absolutely nothing wrong with that for the person, and the company gets the benefit.
Totally, I agree. And actually, I was about to say the same thing, maybe different wordings, but so I always tell my students in my team that one of the challenge in developing age tech and smart homes and all that is majority of the people, and I would say like a large majority of the people who are developing these solutions are mostly younger people. And younger people are developing these technologies for older people, right? Now, my mom is 80-year-old. I have no clue what she thinks, how she feels, how she manages her life, right? I'm not in that age bracket. I can make some assumptions, vague assumptions, but those may be biased by my own stereotypes, right? So there's a lot of stereotyping that goes on. Oh, older people are like this, or older people like that. But that is not true, you know. Taking example of my mom, for example, like she just touched 80. She's aging in a healthy way, and she picked up technology very quickly. She used to be an avid reader, and now she can use phone and read news and stuff like that. And she tells me what's happening in Canada, which is like she lives in India, which is interesting. She would call me at 4 a.m. You know, she couldn't figure out the time difference, but that's fine. At least we are connected, right? Uh, so the big point, what I think Bruce is saying, is about including older adults. Core design, participatory design is the need of the hour. We cannot just treat older people as consumers like iPhone products, this and that, because the purpose here is not very general purpose. You know, it's not selling fancy phones or fancy, you know, sensors, but sensors or smart home devices that are geared to improve your life, quality of life, care, and so on, right? And a lot of this data in future can be accessed by your healthcare providers, you know. So this is something that we are very much looking forward, how we can connect a lot of this data collected through these sensors to the hospital system so that doctors have a good insight about your general trajectory, health, progress, and so on. So inclusion of older adults in the design of these technologies is the need of the hour. Otherwise, it will remain very, very generic, and I think companies will struggle. And we talk to a lot of companies who wants to collaborate, and they have no idea. They just say, "Okay, we developed this solution," and they think, some people think, 5 people in the team think that is going to work for everybody, all the older adults in Canada and North America and in the world, which is such an ill-informed. Yeah, so I think bringing the real stakeholders in the team, and as Bruce said, like advisory groups and things like that can really, really help. And you can come up with new participatory design frameworks, or there are many existing frameworks that we can use to fully utilize the potential of these technologies.
Thank you so much. And maybe just like another question would just be around education. I know we just touched on like we just touched on co-design and how to implement them and the kind of how we can develop these technologies, but education. And I know, Shehroz, one of the things that you talked about in your presentation was the digital resignation that some of older adults have. And you know, even in my own experiences with working in the communities that I do, sometimes it's just around like education, and also sometimes education with people that feel like that there's this huge digital divide between, you know, younger people and older adults, but a lot of older adults are very educated. But for those that maybe are more hesitant to work with smart home technologies that maybe do hold this kind of digital resignation, what would be your recommendations to educate that the companies could do to educate older adults in a meaningful way about smart home options and the benefits of some of these innovations? Yeah, maybe we could start with Shehroz and then go to Bruce.
Yeah, this is a very, very good question that you asked. And so we are already thinking around digital literacy. So digital literacy is kind of a controversial topic. Like you said, some people may have some biases. Older people, do they know technology, do they not know? Younger people also, I can confidently say majority of them have no idea what's going on here. So, this is again a wrong assumption that younger people are somehow smart. It's just because they are younger does not mean that maybe they are more exposed to the technology, but like I think it's on an average it's more or less the same. But of course, depending upon demographics, which country, rural, urban, all those kind of factors also play a role. But yes, one of the important thing that I'm also thinking in incorporating in my future studies, because I think even researchers need to change a little bit their approach. We also work in a very objective manner. Okay, I have a study going on. I'm going to install the sensors in somebody's homes, collect the data, do the analysis, AI, and publish papers, and hey, everybody happy. But I think we need to add like we discussed core design, but also digital literacy. So when we go, we just do not install these sensors. We try to tell them about these sensors. What are these sensors? What are they going to do? What kind of data are they going to collect? What are the privacy implications? What we know about these sensors. A lot of the times things are behind the curtains. We don't even know. Transparency, as Bruce also mentioned, transparency is very important. So I think I would focus more on improving digital literacy in every demographics. And it's just not older people, it's the younger people also, whoever are the users. But in the context of older people, I think it becomes more important because some of them may not have kept pace with the way technology is moving. Every day we have a new thing coming up. So, and identify the theme. So for example, from our work, we focused on these 4 angles, privacy, purpose, risk, safety. So maybe we can develop some guidelines around these, or maybe more. And whenever we sell a sensor, whenever we install a sensor for a research study, we spend few minutes about educating them so that they have an idea about what is being collected, for what purpose, where the data is stored. Do they have any control on data collection process? For example, in our system, we have a simple button to turn on and off the data collection just on the top of the screen of their mobile app. So because there may be some private moments, they don't want to share the data, so those kind of people empowerment is also part of, I think, the success of all of this. But if the entire control is with the company, then people will kind of give up. This digital resignation will happen, right? So sharing the power, I think power dynamics is going to really help in adoption of these devices, as I feel.
And Bruce, maybe you can give the final word before we wrap up today's webinar. What are your thoughts?
So I guess I'll just go back to the digital literacy. There's digital, take the opposite direction. Digital illiteracy is not because they can't, an older adult can't learn. It's more at the, is there an opportunity to learn in an environment that is appropriate for them? All right. And I find a lot of older adults that are extremely digital literate because, the grandchild has taught them. But not, that's a small population out there. One of the groups that we've actually started to do some projects with that I find particularly interesting is there's an NGO in Canada called Connected Canadians, and their mandate in life is digital literacy for the older Canadian. And they have a bunch of different mechanisms they are doing to achieve it in, from one-on-one through to group sessions, whatever it is. I guess the only concern I've got with what they're doing is capacity to scale, right? Because, it's an NGO and, it's a couple of really well-meaning individuals who are doing this as a hobby on the other side of a side job, of a full-time job. And it's amazing what they've accomplished, but it's also a proof that it can get done. Okay. And it's more of a, how do we scale something like that in a meaningful way?
Thank you so much on that note for this amazing webinar that was so informative. And I do feel like this recording in and of itself will be used a lot by a lot of researchers that are thinking through this really important topic of smart homes and how to think about design with older adults, education, issues of privacy, and just education around them with older adults and beyond. So I just really want to thank Dr. Bruce Wallace and Dr. Shehroz Khan today, and all of you that attended today's webinar. You will be able to find the webinar on our channel after the event. It will be posted, and thank you so much. I wish you all a happy Wednesday, and next week is Age Tech Week, Age Tech Innovation Week. So we will be seeing some of you in person. So thank you again, and have a great day. Bye, everyone.
Bye-bye.
Bye-bye.